to John Arns from the Health Board. It says very, very specifically, this proposed charter amendment will therefore eliminate the anticipated subsidy premium, not only for the city of county, but for the city college and the Unified School District, who are also employees within the San Francisco Health System. Anticipated first year, there will be $23 million that will be removed, and that'll be probably the next 4 months.
Why will it eliminate?
Because there will be more money put into the healthcare system by the employees who are going to be penalized by Measure B, and therefore the formula will not be put together. There's also a letter. Anybody wants one of these, give me your card. I will send it to you. There's also a letter here sent by the controller from Ben Rosenfeld that also talks about how this money will also be not coming in because of Measure B passing, because of the amount of money that will be going into the healthcare. The formula won't work. So what you're saying is right. You know, Obama has put together lots of money to help with premiums during this crisis for healthcare. We are going to be losing because of this miswritten bill that does not do the things that it wants to do. $23 million this year, and apparently, according to some of the other documents, $23 million every year is going to come out of the healthcare system.
Thank you. If I could just respond, just one thing, one
My resources.
Yeah, that's right. Yeah. Under the controller's analysis, he says here, should the proposed charter amendment be approved by the voters, in my opinion, the city will have significantly reduced costs of providing employee retirement benefits and health care benefits, with those costs being shifted from the city government to city employees. Annual savings to the city will total approximately $121 million by fiscal year 2013.
70% of that is about health care. It has nothing to do with pension reform. That bill doesn't do what it has to do.
Dave Bishop?
Just a quick question. I have two brother-in-laws that are retired battalion chiefs for the San Francisco Police Department, fire department. And I have a future son-in-law that's a police officer. There's a lot of people I know since having grown up that work for the city. They're cops, firemen, and have various jobs in the city. My concern is, you're probably concerned I'm even asking this question, how close are we, and this might be a question for you from the civil grand jury, are we to bankruptcy? Because I think it might be a lot worse if we go into Chapter 11, and there's going to be a lot less payout for everybody if the state takes over our finances. That's my main concern, and I think a lot that aren't even seeing that. I mean, I'm concerned they can have all the money we have, and but if there isn't the money, then, and we go into Chapter 11, then that is a concern, and that's, I want to know how far away are we, if that can even be determined.
Well, I'd like to start by answering the question, because it is a good question, because there are so many scare tactics that people are putting out there regarding public employees. You ask the director of our pension plan, we are in wonderful shape in terms of any city in the United States. We are not like Malaysia, we are not like San Diego. When he heard the word tsunami, I mean, he laughed when I first met him, a couple weeks ago, or a couple months ago, I guess it was. We are not in that position. There are all of these scare tactics. Things cost money, there's no doubt about it. You want your streets clean, you want clinics, you want San Francisco General Hospital. There are costs attached to that. You know, and I don't hear anybody saying, I want to shut down San Francisco General Hospital. So these projections that came out of the grand jury are considered by most of us in the city to be more scare tactics than actual reality in terms of the numbers.
Willie Brown's out into this, though. Willie Brown endorsed this measure.
Willie Brown has had an interesting career since he's been the mayor and has showed up in a lot of interesting places. Like when he walked across the picket line with Jeff Adachi at the fundraiser at the boycotted Local 2 hotel a couple weeks ago.
And what Mayor Brown has said, I want to speak for him, was that this is something that needs to be fixed. When Tim says, why aren't the politicians not supporting that? I can tell you why, because I talked to them all to try to get them to do this, because I didn't want to do it. And I was told, I can't do it, it'll cost me my election. You know, so I understand that. You know, that's a symbiotic relationship with a lot of elected officials and the union leadership. But it doesn't mean that that's the right solution for San Francisco.
It's about doing it the right way in collaboration, not by just imposing some horribly written piece of legislation that doesn't do what it says it's going to do.
Can I have an answer from the?
Well, I think, yes.
That's a debate.
Surely,
Oh, I just was going to ask, isn't collaboration between elected officials and the unions how to get into this?
I'd say it's Wall Street.
okay. I'm going to go to next to Don Michelle.
What is the percentage of funds of San Francisco budget that goes into these areas of pension and health care for its employees? What's the percentage of the budget? What was it last year? What was it this year? And what's the history to that? Because you as a labor leader are in direct control of the negotiations, and you can control that. And when you look at these percentages, you see that you've done a very bad job. Okay? And if you have the numbers, fine. If you don't, fine. And
Sometimes I wish I had control. I'm called the executive director, but I think I'm called the executive manager. I mean, there are many public sector unions that we're at the negotiating table.
I understand.
There's the people who work at SEIU. There's lighting and the bricklayers. There's people who work at DPH. I mean, the healthcare. I mean, there's a lot of different people, and each union did what it needed to in order to save city services last time around, to the tune of, again, $250 million. So there's a lot of people that are probably rank and file people that probably aren't all that excited that there's another year in which they are taking a pay freeze. I mean, a pay cut. I mean, they're taking a pay cut this year and they're taking a pay cut next year in order to move forward, in order to save city services. So if that's horrible negotiations, I think some of the members might think that, but the city employees care dearly about this town, and they hate it when rec centers close and when services get cut, and they work extremely hard to do that. And that's what happened at the bargaining table. So I disagree with you. We did a horrible job of moving forward.
Let me answer your question specifically. Out of every dollar that's available to San Francisco, okay, 37% or 37 cents goes into salaries. Okay, 48 cents goes into operations, and 15 cents goes to pensions and health care costs for city employees. And what nobody contests, including Mr. Paulson, including Gary Aurelio, who runs the retirement system. This came out in the hearing. We were all present at last week in front of the Board of Supervisors, that the employer contribution is going to double in the next 5 years. There's no question about that. So what we'll have is, instead of 15 cents, 30 cents out of every dollar is going to go into pensions and health care costs for city employees must be do something.
Now,
Here's the follow-on to that. Here's my problem. I really do want the grass cut in the parks, and I want people to be able to go and use the parks. And I certainly want my police department to be functional, and the fire department also. So how do we do that? How do we recruit people and how do we keep them in balance if you have costs like this and you don't want to address them?
We have addressed these costs, and we will be addressing these costs at our collective bargaining table, and we have an open line to the mayor's office, to the department heads, to move forward. I mean, I'm telling you, no other city in the country has done this type of partnering to make sure that we do save city services. These are difficult times. We have not had, hopefully in my lifetime, I will not see anything as bad as what has happened right now. People don't work any harder, don't work any less hard than they have. Productivity is up. People work extremely hard. Wall Street crashed. There's just all kinds of, there's some structural stuff that happened. Wall Street, the speculation, people using money like they're in the casino, selling derivatives, selling people.
Wait a minute.
I want to answer the question.
Wait a minute.
yeah,
Look,
That is the structural
your
deficit.
costs are going up. Your costs are going up. They continue to go up.
Don,
So how do we
answer
address
your
it?
question, Don, and
No, he isn't. If he was, I wouldn't interrupt him.
okay.
I'm finished with my question, thank you.
And, Jeff, unless you have something to say, then I'll go to the next. Now, I see hands in the back. I just want, again, people to understand, we always recognize members first, but I see you. So, Roger.
Okay, does Proposition B affect retirees as well as current employees? I think that's a yes or no question. I'll invite either or both of you to answer.
In terms of the pension benefit, no.
Yes.
Okay, how about retiree health? Does Proposition B affect retiree health in terms of causing retirees to pay more for their health?
Yes.
Okay.
Would you repeat the question?
Probably did too. Okay, thank you very much. That was my question. Thank you.
Would you repeat the question, because we couldn't hear it back here?
The question was, does Proposition B affect retirees at all? And the final answer was, we both said it's yes, retirees will be affected by the cost of health care.
Okay. I know the gentleman with the striped shirt. Oh, well, okay, I'm going to recognize you next, and Autumn's a member. Autumn, your question?
My question may be a simple one. I'm a retired employee of a large organization in San Francisco. I pay approximately $12,000 a year for my wife and myself for medical insurance. You were talking about city employees paying less than $9,000 a year. Why is it a city employee would pay that much less than I do and get better coverage?
Actually, for the lowest cost plan, city employees don't pay anything now. Under Proposition B, they would pay $96 a year. $96, not $9,600.
$96 a year?
And that's what this big fight's about.
It's a single
It's over more than that. It's not true. I mean, there are different plans that you have, and it depends on how many dependents you have and what have you. You get to pick the plans. Everybody's going to have their health care go up.
But my question was, why should a city employee get so much a better deal on health insurance than I do?
You know, there are so many different sectors, both in the private and public sector. There's no singular answer to that. I'm telling you, we're in my union, and bricklayers and people that are buying health care on the street are paying much more than that, like $1,300 a month. I mean, that's what it's costing, for example, for me in my union, for what it costs for our health care.
So Tim has to subsidize my health care because he's a nurse. And that's the problem with the system, is that it's not fair. I have friends who are in private unions, a third of their paycheck now is going to pay health care costs. And they're also refunding pension. We're not doing that in city government. We're still living, 10, 20 years ago. And we need to fix this reality for the benefit of all citizens.
And to finish up on that, sir, this is the city that has, thank you to Nancy Pelosi, and thank you to Mayor Newsom and the Board of Supervisors and the labor moving. We have the closest thing to universal health care in the United States. And I'm telling you, when public employees start not being able to pay to have their kids in a health care plan in town, where do you think they're going to go? They're going to go to San Francisco General Hospital, they're going to go to the clinics and get it, and it's going to cost this city more because of this plan on Measure B. Whether or not it's the $23 million a year that we're not going to get because it's out there, which is important, or whether or not it's because the city's health department, which is the largest department in the city and probably under the highest stress in terms of budgetary stuff over the last years, is going to end up having that much more of a strain for people that are going to have to be dropping their health care because they can't afford it.
I'll tell you exactly what they're going to do. They're going to stay in the city health care plan. Why? Because they can't get anything better. Okay, under Proposition B, a city employee will pay